So, it gives me great pleasure to introduce Martina Anto Okra, who is a doctoral candidate in the Departments of Emergency Medicine Research and Epidemiology at the University of Rochester in Rochester, New York. Her research interests are focused mainly on vulnerable populations and center around reproductive epidemiology, injury research methods and epidemiology, and global emergency medicine. Recently, she focused on traumatic brain injury and functional outcomes after head injury, particularly in females. Pre- and in-hospital determinants of outcomes in trauma patients and factors to decrease morbidity and mortality, especially in under-resourced areas, are of particular interest. Welcome, Dr. Anto.
Good afternoon. It is my utmost pleasure to follow in the footsteps of my mentor, Dr. Jeff Bezarian. And I represent, are there any PhD students, any doctoral students in the room here? So I'm representing all of you here. Are any of you required to do primary data collection to graduate? All right, let's go. Okay. So, how do I move this? Use this, right. I'm not going to belabor some of the points that we've already heard. As it's been mentioned by several others before me, traumatic brain injury is one of the leading causes of death and disability globally. And the CDC indicates that the annual incidence of traumatic brain injury, particularly mild traumatic brain injury, is increasing. 3 out of every 4 traumatic brain injuries happen to be of the mild variety. Concussions, or MTBI, are gendered injuries, so the annual incidence is much higher in men than in women, but women represent over 1/3 of all concussion cases. They have more acute symptom burdens, they have worse sequelae, meaning they take longer to recover, and women tend to actually incur concussions from higher mechanisms of injury. So when you look across the literature, most concussions that men get concussions mostly from athletic mechanisms. But for women, it's really through motor vehicle crashes. And when we're talking about motor vehicle crashes, we're not talking about, oh boy, that went really fast. We're not talking about the gnarly MVC that you see on the road, the mangled car. We're talking simply about just that jerking motion, the whiplash motion of the head. So think about the neck and the head moving rapidly when one gets into a motor vehicle crash. That's not severe, but it can really leave you with that whiplash injury where you have that aching. So that whiplash actually is the brain being tossed back and forth in the hard skull, and that can actually generate shear forces throughout the brain and result in cerebral bruising. All right. So the reason why we're here, and the impetus from my research actually started from when I discovered this article in 2010 by Dr. Angela Colantonio, where she mentioned that a failure to include both sexes in human subject studies has been shown to produce study results and clinical practices that are not only ineffective, but are also harmful, particularly to women. So when you finish quals, you're brooding, trying to figure out, you finish your comprehensive exams, I should say, trying to figure out, what your research study is going to be, and I'm doing a lot of reading, and all I see is mostly these reproductive outcomes that I'm very, very interested in, but more and more repeatedly, they're for men, more and more men. And I'm thinking, well, why aren't women represented? Some of them would include women, but usually in the analysis, they wouldn't stratify by gender. I found that to be a little concerning, so this was very reassuring. So what does reproductive and sexual function have to do with injury? Actually, in the 1987 pamphlet by the National Head Injury, they stated that sexual dysfunction is more the rule than the exception in head injury. That was in 1987. We're in 2017, and we're now doing this conference. What did they know then that we don't know now? So the reproductive and sexual dysfunction resulting from concussion really has to do with the pituitary gland. And the pituitary, as Dr. Bezarian mentioned, is the master gland of the brain. It regulates most of our hormonal functions. And really, it's the communication between the pituitary and the hypothalamus. Those two structures are connected by a very fine, narrow connection of vessels that, given that whiplash motion, that jerky motion of the head back and forth, could cause cerebral bruising and result in disruptions in hormonal functioning. So again, showing this diagram again, for my dissertation, we have concussion. We have our concussion group here. Concussion resulting in some kind of pituitary dysfunction, which we call injury-induced hypopituitarism, where the pituitary gland fails to produce one or more of the hormones that are necessary. and that could result in reproductive dysfunction or sexual dysfunction. And actually, the literature does show that the gonadotropic hormones and the cells that are responsible for generating those in the pituitary gland are the second most affected cells after concussion, following growth hormone. And I should mention here that in my study, the concussion group is compared to an extremity injured group, similar to the SNOOK study that Dr. Bezarian showed. All right, so the study design. All right, guys, here we go. All right, here's the study design for all of you thinking about your research question. So what we did was we identified an injured individual. We only included women of reproductive age. And I had read through the literature. This was very important, but it was actually very personal, the reason why I chose that group, because that group represents me, right? Women of reproductive age, childbearing age, as Dr. B mentioned. You're in your car, distracted by kids in the back or what have you, and boom, whiplash, you have a concussion. That was the reason why I was very, very drawn to this population. So women between the ages of 18 and 45 who report to the emergency department within 7 days of their injury, so 7 days or less of their injury. At T0 in the ED, we will screen them to discuss whether or not they're eligible. Obviously, gender eligibility, age between 18 and 45. We set the criteria at 45 because that is the average pre-menopause age for the typical American woman. We just chose to be conservative in our approach. It could have gone higher, but since we didn't have any hormonal detection, like in the study that Dr. Bezarian showed with FSH, we decided to just go subjectively and use 45 as our cutoff. We did some basic questions about menstrual functioning, and then we consulted the participants and administered all of these criteria, all of these questionnaires at baseline. So 6 to 10 weeks following injury, we then contacted those women, and then we administered our outcome questionnaires. We chose the Brain Injury Questionnaire on Sexuality, which is a new, relatively new, since 2013 questionnaire that's validated for head-injured individuals, including MTBI individuals. Reproductive functioning, we actually chose one of Dr. Colantonio's surveys that she had used, and we derived the questions off of those to ask about menstrual functioning. And we also assessed depression and anxiety using validated scale. And I should also mention that at baseline, at follow-up, we also did post-concussive symptom scores. That's not shown on here, but we did that. All right, so I'm very, very proud of this slide because it's my primary data collection slide and it shows how much work I did for all you PhD students here. We got IRB approval December 22nd, 2016, right, with the IRB going back and forth. We started recruitment on January 10th. On that first day, we recruited 2 study participants. One was extremity injured and one was a concussed individual. So 2 women walked into the ED, we consented them. I'm so excited, right? Within 5 days, we had 9. Now we're really kicking it. We're getting very excited. By day 50, we had 48. By day 48, we had 50 women enrolled in our study. 16 were concussed and 24 were extremity injured. So the momentum, this shows you the prevalence, or actually the incidence too, of the injury in our population, literally walking through the ED at the University of Rochester. And I must mention that I must have lived in a cocoon or some bubble before all of this, because at least once a week I had a woman who sustained her concussion by intimate partner violence. And the literature's out there, perhaps I was blinded to it or what have you, but it was really jarring for me. And when I read the medical records and the descriptions of how it happened, and I had to contact them 6 to 10 weeks later, and it was very interesting when I'll talk to this woman when you said, why didn't they leave? And I'll talk to some of these women, they're like, I'm pregnant now, and I'll ask about the outcomes, or, talking to a woman on the phone and you hear a voice say, put that phone down, and I still have to contact you in 6 to 10 weeks, so I'll try a few days later to see if I can collect those outcomes. So this N equals 50, think of it, for me, it's very significant. Not only in the fact that I was able to get so many women, but the mechanism of injury also was very eye-opening for me. So in 21 weeks, we had recruited 239 women. 101 had sustained a concussion, and 138 were extremity injured. Excluded them for a variety of reasons. And we currently have 85 eligible concussion cases and 119 extremity injured cases at various stages of our study. Since it's a prospective study, they have 6 to 10 weeks to complete the study. So it's really difficult when I'm talking to my committee, the epidemiologists in the room, and they're wondering why I don't have 85 right away. And I'm like, well, I have 85. I have 33 who have completed, but I have about 50 who are still trying to complete. And they're like, what do you mean? It's an ED study, it's rolling. So until I come to the end of both the baseline as well as the prospective phase, I can't literally tell you that I have this many number of completes. So some of those lessons and conversations to have with the committee. Some preliminary findings, the reason why I'm here. So at 6 to 10 weeks post-injury, 23%, which was the same number reported from the SNOOC study, 23% of our concussed women versus 12% of those with extremity injuries had not menstruated since their injuries. Restricting the analysis to women with normal cycles and no birth control use showed even more significant findings. 12% versus 0% of extremity injured women had not menstruated. And what was even more interesting is that 32%, about a third of our MTBI study participants reported changes in their menstrual cycles after injury. So all of our questionnaires we did before injury and after injury comparisons. Sexual functioning, 58% of concussed women versus 53% were scored lower on the brain injury questionnaire on sexuality, which is an indication of poor sexual functioning, but that was not significant. But what was interesting is that our concussed women with decreased sexual function have significantly higher post-concussion symptom scores. So the mean scores on the RPQ was 28.2 for our concussed women and 18.1 for our extremity injured women. That was statistically significant. The reasons and doors were, there were several reasons, but the majority of them were tiredness, fatigue, or pain. So lessons learned here. So we all in this room know that even though concussions are considered a mild form of head injury, following the injury, women may experience changes in their reproductive or sexual functioning. Special attention could be paid to those with higher post-concussion symptom burden. And women who may not be taking birth control at the time of their injuries could be at greatest risk for these detrimental outcomes. But of course, getting objective measures of progesterone levels, similar to what Dr. Bazarian had done, would definitely elevate this to the next level. I'd like to acknowledge my committee members, including Dr. Bazarian, and all the organizers of this conference for inviting me to speak about the preliminary results from my dissertation. I'll be more than happy to take your questions and suggestions for how I analyze the rest of my data. And I also wanted to mention that I'm about to graduate in about 10 months, so I'm actively looking for a job. Where's the slide with my contact information? It just disappeared. So if you can take a picture and contact me, someone, I'd greatly appreciate it. All right. Thank you very much.